Hi, good afternoon. It's nice to see everyone. I'm Larissa Syro, and this is
Jessica Bryson.
and we're here from Cooper Neurological Institute talking to you today about headaches and migraines. Just to introduce myself, I've been working here at Cooper as a neurologist for the past 6 years. I'm a board-certified headache specialist, and I'm also a general neurologist. Why I went into medicine, or particularly headache care, is because I've always wanted to be there to guide people through difficult times, and certainly health issues are some of the most challenging things in one's life that one goes through, and I wanted to be there to advise and be there for support in any capacity that I can. And I know migraines and headaches are an underserved area in medicine. Many people suffer with them, but there isn't as many answers, or there didn't used to be many answers. So that's where I'd like to be of help.
And as I said, I'm Jessica Bryson. I'm a physician assistant with the Cooper Neurological Institute. I became a PA 6 years ago, and I have a background in family medicine where I began for 3 years before coming to Cooper 3 years ago. When I joined the neurology department, I directly trained under Dr. Syro, and that's where I learned all of my knowledge about headache medicine. I'm kind of like an extension of Dr. Syro in seeing the patient load, the migraine and tension headache patients. When there's a backup and there's a need for more urgent follow-ups, I can sometimes get them in a little bit quicker. I went to medicine because I love to help people, and I have a love of science too. So yeah, that's me.
So we work as a team, and we'll be answering your questions today as a team as well. So some of the questions that we're asked in the office and here on Facebook are, what are types of headaches are there? So headaches are of different categories. Some people have tension headaches. That's the most common type of headache out there. And some people have migraines. And then there are other less common headache types, such as cluster headache and the like. A tension headache is when someone has a pressure type of headache. It's usually around the forehead, around the temples, or the eyes. Usually sets in around the evening time. And it's a low to moderate grade headache. Usually people can still do work or go about their chores even though they have this headache type. As opposed to a migraine is a much more severe headache. Often it kind of knocks one out of commission. They have to lay down and drop what they're doing. It's often associated with sensitivity to lights, sounds, nausea, vomiting, dizziness, trouble concentrating.
And usually worse with activity. Like you can't, like if you start walking or going up the steps, like you notice it gets worse with that. It's a big difference between tension and migraine. So a question from Gina on Facebook was that she suffers from migraines and other chronic pain, and some medications don't seem to work for that or have side effects. So what kind of treatments are out there for chronic migraine sufferers? There's a lot of different treatments. We like to break it up into medicinal and non-medicinal, and we really try to hone in on the non-medicinal side. So meaning lifestyle adjustments, cleaning up things that are irritating you in your life and maybe triggering those migraines, and we'll talk about some migraine triggers. So there is a lot of overlap in migraine and chronic pain and some of the medicines that we use for those. I'm not sure what you're on, Gina, currently, but there's a lot of different classes of medicines that can be filtered through to try to help both of them. However, they do come with side effects, unfortunately. So that's why you try to empower yourself with the non-medicinal side of things and try to relax and deal with your pain through meditation or stress management, proper hydration, good fitness and nutrition, and sleep. All these things are really important for mental health, migraines, and chronic pain. So that kind of segues into triggers. Do you want me to do triggers? So, every day when we see patients in clinic for migraine and headache, we ask them, is there anything that you've noticed that brings on your headache or your migraine? And some people will know, yes, every time the sun is glaring at my eyes, I have a migraine, or every time I have a cup of coffee, or every time I have an argument with my husband, some stress, something like that. However, there's a lot of people that don't understand that there are a lot of triggers out there that you haven't really paid attention to. For example, if you're not well hydrated, if you're not sleeping enough. Undersleeping or oversleeping can both be triggers for people. If you are skipping meals, or if you're eating things that have a lot of preservatives in them, like MSG, sulfites, things like that, like in red wine and so on and so forth. Stress we talked about briefly. Stress is probably the biggest trigger for most of the patients that I see. A typical patient will be, for example, a single mom with 3 kids under 10, trying to work on her own and not sleeping well and not taking time out to eat right for herself, doesn't get exercise, and is stressed to the max. And it's really hard to manage stress. I know it's easier said than done, but it's so important when it comes to overall health in general and for stress, for tension headaches and for migraines. So those are some triggers.
Just to the point of triggers, a question just popped up on Facebook about hormones related as a trigger for migraine.
Mm-hmm.
So that is also a big trigger that we see. So when women start their periods around teens or during pregnancy or with birth control pills or around the time of menopause, more migraines can arise or a change in migraines can happen. Mm-hmm. So yes, there is definitely a relationship, and we can target treatment towards that, or maybe that's a time when some of the lifestyle changes that Jessica was just talking about can really be emphasized.
Mm-hmm. Yeah.
So some of the similar ways that we try to prevent migraines by adjusting hydration and adjusting sleep and addressing stress management also applies to tension headaches. So it's similar for both types. In terms of medications, so these are the non-medication ways to help migraines and tension headaches, but we do also offer prescriptions for those who need for medications. Some medications are taken every day to prevent headaches, and some are taken on occasion when a bad headache starts to help break a headache. Treatments can be in the form of pills or also in the form of injections like nerve blocks or Botox injection. And there's even a brand new medication that just came on the market just a month ago, which is a once-a-month self-injectable that we offer for some patients.
So on the topic of injections, we could talk about briefly what Botox is. It's one of the popular treatments that a lot of patients hear about when they come in new. They usually are asking, can I have Botox? So Botox is successful in the treatment of migraines a lot of times, not for everyone. If there was a treatment that was successful for everyone, we'd certainly be giving it to everyone. But Botox can really be helpful, and the way that it works is that it's given in specific locations in the head, some in the face, and some in the shoulder region to desensitize or decrease the pain signals from those areas to the brain and decrease the migraine frequency and severity. And it also, in those areas, relaxes the muscle, also relieving some of the tension that chronic migraineurs have in that area.
Yeah, it's one of our more successful types of treatments that we offer patients. A question from Melissa on Facebook about association between headaches and strong smells. So people who have migraine and on occasion, to a lesser degree, people who have tension headaches can have sensitivity to certain things in the environment which other people may may not really notice or pay attention to. For example, sensitivity to strong smells, or sensitivity to lights, or bright lights or loud noises. So these can be particularly bothersome to people who are predisposed to headaches. And they can be bothersome even if the person doesn't have a headache at that time. So yes, that's definitely an association. There's no particular treatments for these sensitivities. We treat the migraine or the tension headaches themselves, whether by lifestyle modification or prescription treatments, and then that helps both the pain, migraine, and the sensitivity as well.
So Michelle on Facebook says that she has suffered from and is experiencing more and more optic migraines. They come on without warning and last 15 minutes and sometimes up to a half hour. There have been times where she can't focus when that happens, and it looks like a kaleidoscope in her vision. She's seen an optician and can't really get a straight answer in terms of what may be going on. So what are optic migraines and what can Michelle do? So optic migraines are also referred to as an aura. This can happen visually. It can sometimes happen as a sensation in the face, like a numbness or tingling. But I think more common is the visual component. You can see a kaleidoscope-like patterns or flashes of lights or dots, and this is a lot of times a warning that a migraine is going to occur. It can occur in 5 minutes or 30 minutes down the road. Not always, though, will you get this aura and have pain followed. Sometimes you can have the aura and that's it, and that's what we call an optic migraine. It's sometimes easier to nail down when you have the aura and then have pain that follows that it's a migraine with aura, but when you're having this aura and then nothing else happens, it can be a scary thing with these things changing in your vision. So you're right to see the eye doctor and rule out any eye diseases that may be present first, and then maybe going down the line and seeing a neurologist to discuss what may be going on with you.
Yeah. I just want to follow up. It looks like the question from Melissa also has a second part to it. In addition to the question about the strong smells, there's also a question about allergies, and it seems like a few people had questions about the relationship between allergies and headaches. So yes, if people are experiencing allergies, whether allergic reaction, whether it's to environmental allergies like hay fever, or if it's food allergies or sensitivities, that can be a trigger for people who are already predisposed to have migraines or tension headaches. They generally don't cause new migraines or tension headaches, but they can be a trigger just like many other things. Like some things Jessica mentioned, like certain food, for example, food with artificial sweeteners or artificial preservatives can be a trigger. Not drinking enough water, or having poor sleep, or hormone changes, as we mentioned, weather, sometimes low barometric pressure can be a trigger for people. So it's on the list of potential things for people who are already sensitive to having headaches and migraines. On that topic, also a question came up about the association between caffeine and headaches, and I'm really glad whoever asked that question, just because that's a question that we're often asked in the office, so I'm glad that we have an opportunity to let people know about it. So caffeine is a really tricky thing, right? Mm-hmm. Because people find that it helps their migraine when they drink a cup of coffee, so they feel like it's a good thing for them. But the problem is that even though once in a rare while, if someone has a cup of coffee, that may be helpful for migraines, but if someone has coffee on a regular basis, it could actually worsen their headaches and lead to worse headaches overall. And so it also becomes a problem when there's certain medications that have caffeine in them. For example, a common brand name medication, Excedrin, that people get over the counter, has caffeine in it. So when they take that medication, it feels good. But if they take a medication too often, then that could lead to more headaches. So overall, just to summarize, our suggestion about the caffeine is to try to avoid drinking coffee, to slowly wean down or to come off drinking caffeine. That is the highest recommendation. And then once in a rare while, an occasional cup of coffee can be okay to help break a migraine. And you had some other things to say about?
Yeah, and just to note, a lot of times coming off the caffeine, it gets a little bit more painful before it gets better, because you can have the caffeine withdrawal headache. But there's things that we can do to help you with that if we're treating you. But if you're trying to do it on your own, you will get through it. It's just a painful period. But medication overuse headache is something that we always bring up at every visit with our patients, and hardly any know about it. And what that is when you use an abortive medicine or a rescue medicine too often, like more than 3 days of the week. And this includes Tylenol, Motrin, Advil, Aleve, Excedrin, like Dr. Syro said. And one of the common prescriptions that are given is Furacet. So any of those that are used in combination more than 3 days a week can actually rebound the headaches and make them worse and harder to get rid of. And the way to get rid of them is to stop overusing the medicine. And just like caffeine, when you stop, you go through a period of worsening pain before you get better, unfortunately. So if you didn't know about that and you're not overusing medicine now you know not to, so that you don't make things worse. Get yourself in to see someone so that you can get your headaches and migraines managed, so you're not just popping pills trying to get it to go away, missing life events. There's help out there.
Yeah, another question that came up is whether someone who has bad migraines should be going to the office to see us, or whether they should be going to the emergency room or urgent care, or when to seek immediate help. So that is also a good question, and I'm sure some of our listeners have been stumbled with that dilemma. I would say if someone has a brand new type of pain, something that they haven't experienced before, especially if it's a headache that all of a sudden started out of the blue and it's severe, then they should definitely seek immediate help for it. So any significant change in the way they've been feeling from the past, even if someone has a history of migraines, deserves immediate attention. If it's migraines that people have experienced for many years and they're slowly getting worse over time, then it's probably best to see us in the office so that we can start something and follow with you over time to see how these medications or other adjustments are working out for you. Another scenario when someone might need to go to the emergency room is even though they have a known history of migraines, for example, and they have a pretty similar typical type of a headache as they usually did, but one is much worse than their usual, and maybe they've taken some at-home medications and it didn't work, and if they're not able to connect with their doctor in the office very soon, and then that might be a reason to go to the emergency room to get some IV medications to help break it sooner. So in that case, it may not be necessarily like a life-threatening emergency, but a visit to help the pain manage quicker.
Yep, exactly.
Do you want to
Are migraines hereditary?
That's a good question.
Do you want to answer it?
Sure. So the question is whether migraines are hereditary. So the answer is yes, and a lot of people migraines do run in their families. I mean, migraines are unfortunately very common in the general population. They say in 1 out of every 4 households there's someone with a migraine. Of course, people suffer with it to different degrees, once a year versus every day. But they are pretty common, and yes, they can run in families. Many of our patients tell us they've had migraines since childhood, and maybe they weren't as well addressed earlier on, but they've changed throughout the years due to other health conditions and other life circumstances. But even though some family members can have a certain type of migraine or a certain severity to their migraine, it doesn't mean that other family members will suffer with it in the same way. It's so everyone has their own experience with it. So sinuses.
What's that?
The sinus.
So Alice on Facebook says that her sinuses feel full, but there's no drainage, and she has new migraines that are associated with pain and nausea, and they feel like they're coming from the left sinus on the top and the bottom. She did a course of strong antibiotics, which did nothing, so what's next? So you can have migraine pain that feels like sinus pain. It could be in the center or on the front and here in the cheeks. A lot of times that type of migraine is in the absence of a discharge. So I'd say that if you already were on an antibiotic and you don't feel any different, then perhaps it'd be best to follow back with your doc and ask if it'd be worth taking a picture of the sinuses, for example, X-ray, CAT scan, to see what's going on in there, if it is sinuses at all. And if it's not, and then we're working with something that might be more so migraine, that's something we could help you with. And they're treated the same way as other migraines too.
Yeah, migraines can look like many other conditions, sinus being one of them, just because the location of the migraine can really vary. Can be around the eye, and it lets people to think that they have some sort of an eye problem, or it can be around the sinuses, letting people to think that they have sinus disease. Yeah. Migraines can be tricky, and they can come in many different forms and shapes. Another good question that came up is, what is biofeedback in relation to migraine? So biofeedback can be an excellent treatment for migraine and other versions of chronic pain, whether it's neck or back pain, whether it's fibromyalgia, or any pain associated with other disorders that someone suffers with for a long time. So a biofeedback is something that one can train on their own, learn on their own, or train with a counselor. And there are many biofeedback specialists throughout South Jersey. There's, if you might find on Google, it's a sort of, I guess, self-therapy where when a person experiences pain, they pay attention to their body reaction. So they pay attention to the way they're breathing, or their heart rate, or how tense their muscles are. And then they work on their body reaction to the pain. So they do slow breathing exercises, for example, to help relax the body's reaction to the pain, and thereby helping ease the pain. It's something that takes practice, but it can be extremely helpful for people who have chronic pain. And chronic pain, I mean long-term pain for years, months to years.
Yeah. And we really try to hone in on that as a treatment, so that you're giving yourself the power back, rather than relying on a medicine, being somewhere and not having a Tylenol or a Motrin or what have you. Knowing how to do this technique, or having practiced it, can really save you in an instance where you can't get to a medicinal treatment.
We have another question regarding someone, it looks like Melissa's husband, has headaches every few months, and these headaches are associated with nausea and vomiting, and so the question is whether this can be a migraine. So this is a migraine is a possibility for someone who has headaches with nausea or vomiting, but it's difficult to say, without really talking to this person and getting to know their life history and doing an examination. It's difficult to say for sure whether this is a migraine. Certainly, these are some of the features. Migraines also come with other features, and we want to be sure to not miss any other possibilities. So we're very thorough in the office about asking all sorts of general medical and personal history, and examining our patients, doing a thorough neurological exam, an eye exam, to make sure that it's not something else besides a migraine. So certainly if someone has frequent headaches and has nausea, vomiting, it's worth seeing a physician for a checkup.
Mm-hmm. Absolutely. So, just to wrap up, some things you can do on your own before coming to the office to start paying attention to your lifestyle and start making a correlation to things that may be causing your headache or your migraine, because you could simply get rid of them. For example, coffee, Chinese food, a hot dog, red wine, what have you. Just try to get it to go away and maybe your headaches will get better. But if they're not, certainly come see us and we'll help you the best we can. You can visit our website at cooperhealth.org to get some more questions answered and make an appointment if you feel you need one.
And feel free to post your questions below. We'll still be around answering questions after this Facebook Live. And we're happy to continue an interaction in the office, as Jessica said, or via other forum. We really appreciate the opportunity to talk to you. We love working with people to help them with their headaches. So we hope you have a great day.
Thanks.
Mm.